Hello everyone, welcome back to the channel. It's another exciting day. Thank you for watching and thank you for staying with us. Today we're going to talk about a very important topic, and that's the NHS non-technical skills, and it's a key and vital part of the NHS interview. Remember, we did the last video on Tell Me About Yourself, demonstrating the CAM technique. If you've not seen that video, please go ahead and check it out. If you've been having value from the content of this channel, please do like this video, subscribe to the channel so you stay informed. Thank you. So without further ado, I'll get into the presentation for today. Now, what are non-technical skills? Non-technical skills are cognitive and interpersonal skills that complement the practical and technical competencies. Remember, there's a lot of competencies that is required across various grades in the NHS, and this is dictated, for instance, by the GMC, the Royal Medical College, the Trust guidelines. Non-technical skills are key in helping the decision-making, leadership, and teamwork, and of course, amongst other things. Now, before we go into the bank that we have to give you to practice, I would like to talk about some of the models that's been designed to help in addressing questions like this. And at the very top of the model, there is the STAR model. The STAR model is the most popular and probably the most easiest to use. There is the CAR method, there is the SOAR method, there is the SOAR method, there is the PAR method, and there's the parade method. However, the STAR method appears to remain the star of the show. Now, let's look at some of the question banks and possible scenarios that you may find, and we've put them in categories to help you easily use them in your preparation. Now, but before we go to the bank, one more thing. Let's explain the STAR method. So the S in STAR is the situation. And what you're doing here is you're simply describing the background or context of what was asked to you, or what you want to use to answer the question that was asked to you. So the next is the task. And what you need to do here is explain what needed to be achieved. Followed to that is the action, and it's the step-by-step process that you took to address the task. Now, you need to explain the steps, and you also need to explain the alternatives you considered and why you chose these steps. Finally is the results. You need to give a summary of the result you got by addressing the situation and the task using the actions that you took. It's equally important to have both qualitative as well as quantitative results to discuss, to illustrate the effectiveness of your approach. So that's the STAR method. Let's now look at the categories. So the very first in the category is, think about patient communication, empathy skills, and being a patient advocate. And they're about common 5 scenarios that you can have. Everything from communication skills to empathy skills to communication skills impacting on the outcome of patient care, and also when you might have not advocated for a patient properly. So we recommend you take time and practice these skills, and most importantly, use examples from your practice, but don't forget to anonymize the patient data so that this becomes real and comes across very nicely during your interview. The next of this category is the clinical decision defense skills and thinking outside of the box. Now, it's important to be able to defend, your clinical judgment. And you may find that this is required of you by colleagues, patients, nurses, students, or even, in an academic setting. And also thinking outside the box. So again, we have about 5 possible scenarios that you can use here. Everything from the treatment you offer the patient to, using a new and a different approach, down to being holistic and down to dealing with a skeptical patient. Like I said previously, do not forget to use examples from your practice, but do remember to anonymize the patient's data. Now, let's talk about obtaining informed consent in ordinary and extraordinary situations. This is again something that would come across, especially in specialties where procedures are commonly done. So that could be obs and gynae, surgery, endoscopy, gastroenterology, and other specialties. So that's a skill that you want to work on. Yeah. And so again, use experience from your practice. Do not forget to anonymize the patient data. Now we must talk about team, collegiate working, and leadership as a key part of the non-technical skills. So everything from how well you play in a team, and what your role is, and when you fail to play well as a team member, to also things like leadership attributes to your decision, for instance, to work in that specialty or train in that specialty. So a lot of things to consider here. Key part is duty of candor, responsibility, accountability, personal management, and reflective practice. So scenarios here, the mistakes you've made, demonstrating professionalism, organizing workload, handling stress, and areas of strengths and weaknesses. So again, do not forget to use material from your practice, anonymize as appropriate. So finally, supporting colleagues. You would work with colleagues, medical colleagues, non-medical colleagues, nursing colleagues. You need to also be able to develop skills to support them. So this is the category. So this here concludes this training. And thank you for listening. Thank you for watching. And don't forget to like this video, subscribe to the channel if you've been having value. Leave your question down in the comment section below. Just a quick recap. Yeah. So at this point, we've talked about the non-technical skills in the NHS. We've said what they are. We've also given the categories which they belong. Yeah. And we've also given the advice in terms of the models you can use. And we've also talked about, the use of content from your practice and remembering to anonymize them. Thank you for listening. watch out for the next video where we tackle each of these questions and scenarios in details. Bye for now, and do take care and good luck with your NHS interview, and bye.